Hello everyone. Excuse me. Thank you so much for having me. It's fantastic, even if I am an interloper from Dorset. And I was say yes, I'm. It's really fantastic to be here. And I can say actually one of the reasons that I've been here, that I'm here now, is because I've worked with professionals outside of pharmacy, particularly Will, who I've met in various green groups in person before lockdown. And it's been so supportive and has given me the encouragement to do things, which is how my group got together. So can I just share my screen and I'll just show you a little bit about what we're doing?
Yes,
it's very quick, very simple. So hopefully you should see my screen now.
Yep, brilliant.
Amazing. So I'm just going to try and go on to slideshow. There you go. So I am here from Pharmacy Declares, which was only set up about 8 months ago. And again, it came about because I'd spent a year or two hanging out with medics and nurses and midwives, and there was just like no pharmacy action. So I thought, something has to be my tribe out there. So with the help of someone within, these are our key aims. Again, we've stolen these from the Health Declares emergency team because it was just so fantastic. And in a nutshell, it's what we wanted from our professional bodies. So we got together as a group and we decided that we just wanted the Royal Pharmaceutical Society and the General Pharmaceutical Council to really do something because they're complete laggards in terms of climate health leadership. We set out these tasks, so fossil fuel divestment, declarations of emergency, and then just to show some leadership and bring, climate education into the profession because there was nothing at the time. And this was our background. I'm sure everyone here knows this. I've stolen this from somebody else's slide. And so this was the tweet that went out back in February this year. And I was really worried it would go out and just disappear into the ether and never come back again. But something really fantastic happened. So I went from being all on my own down in Dorset to all of these amazing people popping up. So we now have this self-convened group of pharmacy professionals. We're not professionalists, so it's pharmacists, technicians, assistants, anyone who wants to get involved. And we have this network that spans all of the UK home nations. Recently, we've been working with colleagues in Australasia, the EU, and America, doing really great things across borders. And we have been working with all of these groups. The RX for Climate thing you can see in the top right hand corner, our American arm, if you want. And we've seen some really great stuff in the last couple of months. So this was the first climate emergency declaration. This is the UK Clinical Pharmacy Association, and they were just brilliant. Once we spoke to them, they're not a great big organisation, but they really got excuse me, the key health messages, and they declared back in May, which was fantastic because it really set the standard for the bigger organisations. And then the Association of Pharmacy Technicians followed shortly after, and then we got our first one from a big pharmacy organisation later this year, which was brilliant. It shows we look at it in terms of this is the diagnosis, so that it sets the standard for what we need to do. It shows what we need to target and how we need to channel our action. It was a little bit controversial because the Royal Pharmaceutical Society still hold quite a significant chunk of fossil fuel. They still hold a really big investment portfolio and pensions, and they haven't divested from fossil fuels. So we're working on them for that. And once they declared, there was such an uproar because we had this network and we were all working together and telling each other what was going on, that the president has come back and said, hands up, they know that this is wrong and they have work to do, and they are going to be discussing divestment at a meeting on November the 17th. So fingers crossed. Yes, we all hope that goes well. And if anyone wants to help, we started this change.org petition. If you could just sign it for me, that would be amazing. The president has asked to see it before she goes into the meeting. And although we're asking pharmacy organisations to divest, we're asking any adult who will be affected by climate change to sign this. So if anyone wouldn't mind, I'd be so grateful. It would mean the world of difference to me. And we have lots going on in the future. So this is slide is a couple of months old, but things are just rolling along really dramatically. So I think, inspired by all of the people that we've been working with, we have sort of got fingers and tendrils into all sorts of different medicine sustainability programs. So we are working on the RPS for divestment. We are working with the General Pharmaceutical Council, who are a real stick in the muds, and until recently have ignored everything we've reached out to them with, but they've just come back now, and they've acknowledged us with a letter that says basically we've done nothing, but we realise we need to. So that's a really positive thing that we hope to end the year with. Because the group is so widespread, we've pulled in people with different expertise. So we have everyone from undergraduates to chief pharmacists and professors of academia, the whole range. And so we've managed to get sustainability incorporated into prescribing competency frameworks, into benchmarking standards for consultant pharmacists, all sorts of things. And we have people that are writing the pharmacy green plans for ICSs in different areas around the country. So there's an awful lot going on, and we've got research for things such as developing metrics for how much of a pharmaceutical is passed out through a patient into wastewater, that kind of thing. There's a group of us that are sort of dotted around the country, and we're sampling pharmaceutical pollution of waterways around the UK, all sorts of things. So we're really happy with the sort of the momentum that is being built inside this organisation. And this is our message to everyone. It's just, we've said, there's no option now. You can't draw a circle around climate change and just park it. We realise that it overlaps with our professional activity, because like everyone else here, we're going to be at the forefront with dealing with the fallout of climate change. And so we're also trying to get the message across that we can do what we want within work, but as health professionals, we have this social standing and platform. And if we recognise it, we can use it to deliver healthcare that goes beyond just the medicine stream, because people will look up to us. So a lot of our work is about building confidence in the less vocal members of our group, so that they are confident to go out in their communities and talk about what they're doing and why they're doing it. And that's us in a nutshell, really. I will stop sharing. But it's just been a real whirlwind of activity. We're all doing it, like I'm sure everyone else is, in their own personal time. But going forward, we're hoping a lot of us are now getting sustainability written into our job description, so we hope we can bring it into work. I've just had a meeting with my chief pharmacist, who I've discovered, to my new joy, he's very new to the trust. He's a complete greenhead like me, and he's really engaged. It's amazing. It's so wonderful to have senior leadership that really buys into this. And yesterday, myself and my colleague Peter, who sort of helped out the group, we were invited to go and present to England's Chief Pharmaceutical Officer, and he wanted to know about how pharmacy as a profession can approach climate change and adapt to it, because they said they've done a lot on medicine sustainability, but they haven't really thought about how, what will happen to health buildings, pharmacies, GPs, clinics and things when they're flooded, or are they, suitable for looking after patients within, in the middle of a heat wave, that kind of thing. So there's lots going on, and we're really hoping to use our influence to do a lot of good. I guess my last request is, if you know any other pharmacy staff, please send them my way, because we're always looking to expand further. So thank you very much. That was a whistle stop tour.
Bloody brilliant. That is fabulous, and a really brilliant way to sort of draw this now, because we've heard so much, and there's been a lot of sort of crunchy, meaty, carbony stuff from Alan as well in there, and the last couple of sessions have been really, really uplifting, fantastic. I'm so impressed with what you've done. I'm so impressed that you've just taken it on.
Oh no! Well, I'm going to say thank you to you, Amanda, because what people probably don't know is that I ring Amanda occasionally when I say I've got this message I need to get across. Give me some keywords and some buzzwords that I can use, and it's really made a difference. So thank you.
But my pleasure. And I think the way that you've been framing it as to pharmacists as, okay, we have a diagnosis, so what are we going to do? and making that connection between planetary health and human health.
It just helps. It helps the teams, I find, that are a little bit reticent. It helps them feel a bit more confident in how they approach it, because it makes it a bit more familiar to them.
Yeah, exactly right. It's all about communication. So really brilliant. Any thoughts? Or Will, you've got your hand up.
Yeah, Tracy, thanks so much. I didn't do anything. I mean, I've got to say, it's incredible.
There was a lot of counselling and like bigging me up in the middle of a demo in King's Cross. I remember that really clearly, and it sent me on my way.
But I could see that you had all these ideas and you were just ready to absolutely smash it. And that is what you've done. I don't know how you've done that so much. I wasn't expecting like that much. So it's absolutely incredible. And, the influences thing of these things just grows and grows. So it's amazing. So, so be sure you have that conversation with the next person, because like Amanda, this is a sort of like dominoes, one person triggers the next person. So that's that. I was just going to say briefly about Health Declares. You may not have all heard of Health Declares because it keeps itself a bit quiet, but it is an incredible resource full of some really great people and expertise, all designed to get hospitals and, well, mainly secondary care, but primary care on the right track with regard to declaring climate emergencies and getting organised to go to reducing their carbon footprint. The resources are amazing. The people there are absolutely incredible. So you probably haven't heard of it because it's just a bit quiet, and it's run by, everyone's doing it in their own time, but it's an amazing resource and it's well worth tapping into. Anyway, really well done, Tracy, and just keep going.
Thanks. Thank you so much.
Yeah, completely. I have to say that I have been having bashed around with various activisty people over the years. I am in awe of clinicians, not just because you're super massively busy anyway, but especially over the last couple of years. But you've absolutely put yourselves on the line in the way that all sorts of clinicians and health and care professionals have actually literally sat on the line, sat on the front line, and being willing to be critiqued or pointed at or arrested. And it is honestly, utterly awesome. So thank you. Has anybody got any particular questions that you'd like to ask? Melissa and Maggie. Oh, you're on mute, Melissa. Far away. Oh, we still can't hear you. That's odd. No, it's still. Oh. No, still can't hear you. Is that because you've got a tiny bandwidth? Well, tell you what. Okay, if you want to type your message, I'll see if Maggie can take the floor and then see if we get your sound back. Maggie, fire away, and Melissa will type.
Yeah, hi. Hello, Tracy. Thanks so much. I just wondered what you see as the future for sorting out the solution of medical.
Oh,
you right?
Oh, sorry, I didn't hear that. What was the future?
I didn't quite hear that. Is there somebody in your
No,
room?
It's not in me. It's not mine. There is a voice, but it's not mine.
Okay, if everybody could just mute themselves, because there's somebody walking around in moon boots somewhere.
Not here. Yeah. Tracy, I just wondered what's your idea of the future? What's your vision of the future of how we are, if we can, sort out medication in water, in pollution? Where's it going?
So that's an area that we don't have a lot of information about now, but if you want to, there are some brilliant people working on it. If you want to look anybody up, there's a lady called Sharon Flager. I'll put her name spelt rather unusually, so I'll put it in the chat bar. But she's in Scotland, in NHS Highland, and she's a pharmaceutical consultant in public health pharmaceutical consultant, and her area of specialism is water contamination with pharmaceuticals. So we were really pleased to nab her. She's a really big name in my sphere, so she's part of our group, and she's doing lots of work, and she's done this incredible piece of work in the Highlands, where they worked with the local water board, and they've got a clean water certification because they've managed to do that. But so what we need to do is get a really up-to-date local picture of where the pollution is happening. The other thing we need to do is find out what happens to those pollutants once they go through wastewater treatment plants, because we know that 30 to 100% of a drug goes through a patient and goes into the water system, and sometimes the wastewater treatment plants not only can't remove it, but sometimes they activate it further. So basically we need a ton of research, and there are various people looking at this now. There's an amazing doctor called Richard Hickson. He runs an organisation called NHS Ocean, so absolutely worth following. So this year he's been trying to get procurement of healthcare that travels across the ocean, raise awareness of that into that with the Greener NHS team, so that we can reduce the harm. But next year he's going to start a project on molecular pollution with pharmaceuticals in the ocean. So there are lots of pharmacists obviously who are really keen to join in that. So at the moment it's just a ton of research, but I can just tell you from my point of view, what we've been doing is we've been using all of our contacts in pharma and just saying, like, all of your moves to net zero are fantastic, but what we need now is information on the ecological impact of medicines. So for a drug to be licensed, you have to produce an ecological impact report, but it bears no resemblance. It bears no has no impact on whether you get a license or not. So you can have a drug that's completely toxic in the environment. It does awful things, and hey, you still get your license. So we are starting a mass call, and we've joined up with the Royal Pharmaceutical Society to call for this as well, for that information to be made easily available for every drug as a starting point. And I guess our first target is to make this information easily available, and then what we want to do is develop some kind of like RAG rating, so that should you go to prescribe for your patient and you have 3 drugs, you can say, oh, I don't know, of those 3, I know this one is less environmentally toxic, so maybe I'll pick that one, just to bring it into the conversation. And the other thing we're doing is we are keep badgering Greener NHS to move beyond carbon to include this kind of thing. So the Nordic countries already include environmental pollution in their new procurement framework. So they're starting to do this. And I kind of think, again, we need to encourage this competitiveness and race to the top. And if Norway and Sweden can do it, then, you know, England can too. So that's what we're asking for. So there's no real quick answer at the moment, but we've got some ideas about where we're going to go with it. And obviously, as soon as anything happens, we'll let everyone know.
Thanks.
Well, does that help, Maggie?
Enormously.
And I'm just putting Sharon Flager's name in the chat bar. If you just follow her on Twitter, she talks about environmental pollution with pharmaceuticals a lot.
Brilliant. Thank you for that. And Melissa wanted to say thank you to Tracy. That was really inspiring. As a physio on the periphery of a group working on the CSP about their tardiness, it's good to remember there are positive tipping points too. So yeah, really, really brilliant. And Kavita's saying that the BMA talked on this recently, studies about SSRIs, double SRIs and benzos, etc. in water, first pass metabolism, etc. And I'm just wondering if now that Alan's come back and he's talking that pharmaceuticals are next on the list of CPFT, it'd be great to see. That was a brilliant talk there that you might find interesting to watch back when he sent out the recording, Alan, in terms of the impacts of pharmaceuticals. Really, really brilliant. Kavita, did you want to come in there?
I know. I was just it was just interesting because I hadn't, again, before this talk, I hadn't thought about the metabolism of the drugs, and I mean, not only the metabolism, but also a lot of people still flush their medicines down the toilet, and so then it directly goes into the water systems as well. And there was one study about the SSRIs, so medication that we use for anxiety and depression, and they have tested all the different types, and sertraline out of all of them was the least sort of present in the water, and then they also did one on benzodiazepines and the behavioural impact on fish, and who then went a bit crazy, I think, and swam to the wrong places, so missed the breeding grounds and things like that. So it was just suddenly thinking, oh my gosh, these more and more impacts that you know, on a daily basis we'll be prescribing and not being aware of. So yeah, if there was some way of I think, well, talk about myself as a GP, I definitely rely on our clinical pharmacist in the practice to help guide a lot of that prescribing. And if we had some clear guidelines of which ones are most cost effective, but also least environmental impact, that would be fantastic.
It's an aim, isn't it? We can only aim high.
Yeah.
Absolutely right. Melissa, do you want to try again? Because you're on mute this time, but if you unmute yourself, maybe it'll work. Bated breath. Okay, Melissa's going to continue by typing. Fantastic. I've just made sure that Alan knows who you are, Tracy. Is it okay with everybody if I pass emails around from this group so that people know who is who? Would that be okay? Brilliant. If you don't want me to pass your email on, then just email me and I'll keep it out of the list, but that would be brilliant. Thank you so much for that. It's also made me think as well that just fab. One of the things that surgeries can do and practice can do, and I know that the bigger estates are thinking about this in the wider disinvestment thing, is of course look at who you bank with. Because we can either get overwhelmed by the number of things to do or see all of these as an opportunity to do good, and who you bank with is just as important as who you get your energy from, actually. And if people who are working in surgeries want to find out a little bit more, if you subscribe to Ethical Consumer, I've subscribed for Volunteer Cornwall. It's fantastically knowledgeable, and you've got access to online databases where they've done all the donkey work to figure out which direction you should be going in and who you should avoid like the plague, and they're fab. So have a little look at Ethical Consumer for those small businesses to see if you can help you make some of those decisions. I know that we've got Ros back in. I know that Tamsin and Rob White aren't going to be able to make it. Ros, did you want to say something? Great banking check with Switch.money. Thanks, Tracy. Ask your accountants what their sustainability plan is. This is part of our procurement footprint. Good one. That's a good one. Ros, did you want to just give us a couple of quick words about what's happening at RCHT at the moment? Just very quickly on the spot, because I know that everything.
I wasn't planning to, but yes, absolutely. Yeah. That's fine.
Thank you.
So we've come quite a long way in our journey, as I'm sure some of you know. We now have reusable masks in non-clinical areas and in clinical areas, and I've been working with NHSI quite closely to get that in place, and also to get that throughout the UK, which is really good news. We have just about to get our first Entonox cracker, or NOx cracker as they're called, into endoscopy on the 26th of November, and that's another way to get greenhouse gases under control. So we use a lot of Entonox in endoscopy, so that is a bit of a secret. It's not out there yet, and we're working with a bowel cancer screening team, so when it is announced, it gets a lot of publicity, because then lots of other hospitals will do the same thing. Obviously, we've already got our Sage Tech canisters in for the volatile gases as well. On the 1st of December, we are doing a county-wide webinar with Kavita for the big inhaler swaps. That's MDIs to DPIs. But the important thing to note with that as well is the bit that we're also concentrating on is a way to deliver grants for warmer homes. So obviously knowing that we're going to have a wetter, warmer Cornwall means that if you live in areas and you suffer from fuel poverty, what will happen is you have mold in your house because you can't heat it. And being a hospital, we have the best patient, we get everything through here. So we can catch them as they come in, and then we can sort out the grants for them, which we're working with the council. And then hopefully, all being well, they never come back in again. So one of the areas we're trying to kind of start to concentrate on, certainly for this year coming as well, as our emergency planning, is far more public health related. So I've just spoken this afternoon actually to some of the dentists throughout the southwest. So we have a massive problem in Cornwall, and I'm sure you all know for dentistry it's a really big problem. But how can we sort out the kids at school to get them brushing their teeth so that they never come to the point where we're actually giving restorative care, where we're using loads of plastic, loads of chemicals, all these nasty things, mass expense, and obviously an awful lot as they get older. So we're just working on that. There's a big thing coming down at St Michael's, which will be creating a green theatre. I can't talk much about that just because it's embargoed at the minute. But that will be coming out shortly, and that's for basically full PPE down at St Michael's Hospital in Hale, but then we'll work up to see if we can do a full green theatre as well. We've just got our uniforms sorted out, so we're no longer going to logo them anymore. So obviously uniforms create a vast amount of waste, which if they're logoed, we can't do anything with, they're dead to us. So our amazing secretary, Rhiannon, has sorted out with, I've forgotten where it is, she's on the call, somewhere up country, where we're going to send them to from now on, and then they go overseas to Afghanistan, to Romania, places like that, who are in need, and we can help them. And why logo them? It's just silliness. What else are we doing?
That's quite a lot, Ros.
No. We've done, like, you know, we've had a full year of loads of stuff, but it kind of goes in and out of my head because we're always planning the next stage. So the big one's coming, the big inhaler swap, the NOx cracker, which I hope will be really good, because then I can put that throughout all our endoscopy suites. So we've got 6 in total, and over to maternity as well. So we can do it. I thought I'd do one big case and hit the whole lot, because when we've done that, and if we've got the Sage Tech in as well, there's not really anything further we can do with gases. I think we've pretty much got a big tick against that one. The other important thing is we've got approval as well to get an energy manager for estates. So that should be appointed, but not starting till after Christmas. So where I'm perfectly happy to lead on, you know, I can do the medical stuff, I can do the staff engagement. I'm rubbish at estates. I can't do what Alan does. I haven't got a clue, and I'm not interested in it either. It's not my thing. I find it quite difficult to do the technical part. But if we can get someone in place, and luckily our new deputy estates manager is hugely into sustainability. He's just put a load of work over in Penwith College. It's got the turbine in the car park he was telling me about, and he did that. So that's all good news for us. And with our substation that's about to be built, we have no choice. We're in an old hospital. We need the substation. That will then allow us to get in the big EV chargers and start to change our fleet over to electric cars. So there's lots coming this year, just not quite there yet. We'll do far more with public health, also with a lot for patients with NAFLD and diabetes. We want to start to try and do more vouchers for fruit and veg, and a bespoke tour around Tesco's or similar about this is what you know, go and buy healthy food, not processed, and Weight Watchers or similar. Rather than give a pill or just say, yeah, sorry, you're overweight, come back in 6 months and nothing's changed. We're not giving any value. I can't afford the waiting list to keep growing, and I'm not doing anything about it either, certainly not that's constructive. And certainly we've had massive support from our execs. So I did public board last week, over the moon. They're so happy. They want us to come back every 2 months now to keep updating them. So huge engagement. We're getting it throughout the care groups now. So they're starting to have their own ideas. And the more we can,
that counts as, and what everybody's talked about today is the social equivalent, the social and health and care system equivalent of those really awful positive feedback tipping points that you see in the climate science. But these are the good tipping points where in actual fact you see those feedback loops, and one thing happens, which means that something else is likely to happen, which means that it enables something else to happen. And suddenly all the things you're talking about, Ros, is you're clearing space and making a route through. So then we can do that and that and that.
It's definitely becoming more normal. I mean, even the emergency planning, which actually is really interesting. So we know if we're now 50 times more likely to get a killer summer now any minute. We're just waiting. But because our hospital's so old, we don't have the ventilation that we need. So now we've built the new, it's called PRU. It's got a new name, can't think what it is. We've got really good ventilation in that. So what we've done is built in a management system which will flag you on the ward. So if you have a comorbidity that's going to trigger in heat, not only can we not give you certain drugs, but we need to find you really quickly and shift you over into the big vented, the prefab build is what it is, to be honest, but it's got brilliant ventilation. So there's all these kind of bits that we're working on, and we're working with the University of Exeter, Peter Lafort, he's helping us do that. So we know the flooding areas, we know what we've got to build up on. So it's coming on quite well so far. That is where we are.
Coming on quite well. I think that's a massive understatement. I think Melissa just said this afternoon has left me with such a big smile on my face, and I think the same for me. Actually, there's so much brilliant stuff going on.